How do you want to see general practice change?
Well, general practice is a great strength of our health system, but I think it can work differently to deliver whole person care, the social as well as the physical and the mental. So I'm interested in new ways of working, how GPs might not just wait for people to come to them, but how they can actively manage the at-risk older population to keep them healthy, comfortable and out of hospital.
So do you see the role of the GP changing?
It could do, but I'm not talking about imposing anything on anyone. What I want to build is a system where we tilt the whole thing away from the hospital and all of our efforts go into the home, keeping people where they want to be. And so, that does imply changes for how people work, but it has to be done locally and people have to decide how those things will work. But I think the challenges of the 21st century are such that we all of us, need to think how we've been working and open our minds to doing things differently.
And what do you want to change about CCGs?
Well, I have no objection to doctors being involved in commissioning. I've always said that. But I think the 21st century does require us to take a broader view of commissioning for health, not just commissioning health services, but commissioning good population health. So that link with housing policy, planning policy, leisure, libraries, parks, education when it comes to young children's development. The broadest view needs to be taken of health, and that's why I say in my view the Health and Wellbeing Board needs to come to the fore, but CCGs remain and they advise on what the specialist medical input needs to be.
And what would you say to hard-working GPs on CCGs that might be disheartened to hearing that Health and Wellbeing Boards will be in charge and CCGs will just have advisory roles?
Well, they shouldn't be disheartened because, as I've said quite clearly today, CCGs will stay. And that's actually quite a big statement for me to make, given that we bitterly opposed the bill and still do. We didn't think the NHS needed to be thrown into this turbulence, so it's quite a big thing for me to say. But what I am saying is, just the kind of narrow medical view of the world isn't really going to rise to the challenges of the 21st century. We have to take a broader perspective. We can't just run a medical model, a patient-centred approach. We need a person-centred approach to good health. So that's why looking at the Marmot report and all of the broader determinants of health, worklessness, housing, early years, those are the things we now need to play into our commissioning strategy, and I think that's a logical evolution of where we've been.
And do you plan to get rid of any qualified provider?
Well, I've said clearly today that NHS preferred provider is my model. I believe in the public NHS. I believe what it stands for is the truly important, patients before profits. And I think that sentiment is shared by the public. And I'm not against voluntary providers coming in, private providers. I welcome a mix of providers. I also welcome patient choice. But it should be done within the context of NHS preferred provider, giving that stability to the system so that it can embrace change. Any qualified provider, the kind of open tender approach, means that everything's up for grabs all of the time, and so therefore nobody embraces change because it's all so threatening. My fundamental analysis is that it won't deliver what the future requires. Families are demanding integration, and in the end markets deliver fragmentation.